Hello, welcome to the Safeguarding Champions Forum 2021. My name is Christine Johnson. I'm the MCA Dolls Advisor for the Trust, and I'll be providing you with an update on MCA Dolls issues. This will be followed by Safeguarding Adults, Safeguarding Children, Maternity Services updates and Looked After Health team updates. I hope you do enjoy. Many thanks.
I would just like to start off with the additional guidance that was updated on the 24th of December 2020 in regards to the Mental Capacity Act and deprivation of liberty safeguards during the coronavirus. And basically what the guidance is saying is where life-saving treatment's being provided, that's including for the treatment of positive COVID-19, then a person will not be deprived of liberty as long as the treatment is the same as would normally be given to any other person without a mental disorder. Providing life-saving treatment refers to any treatment that is needed in order to stop the person from dying. So in some cases when a person becomes infected with COVID-19, this can be life-threatening. So in these cases, treatment to prevent deterioration of their condition is classed as life-saving. And this only applies where a person would die without relevant treatment. Again, if anybody has any uncertainty or needs any clarity, then I would advise that you contact the Safeguarding team and contact the MCA Dolls Lead, who will be able to give you further advice and support in regards to what life-saving treatment means. This slide is really to highlight the importance of understanding that once active treatment stops and your patient continues to lack capacity to consent to hospital stay and treatment, then we have to apply for a deprivation of liberty safeguard. And in order to do that, it's the usual process. You would complete your MCA 1 and 2, and they can be found on Meditech, and complete and forward Form 1B, and that goes to the Trust MCA Dolls team for quality check-in and processing to local authority. Local authorities will then contact wards by telephone for assessment purposes. This slide is for those who are signatories of consent for elective procedures, and under the Mental Capacity Act, as decision maker and signatory to consent to surgery or procedures where there are concerns that a patient does not have capacity to consent, all people should be completing MCA 1 and MCA 2 on Meditech, or complete the hard copy MCA 1 and MCA 2 templates found on the Trust intranet section under MCA Dolls, and this should be done before signing consent for on behalf of the patient. This slide is just to clarify how to interpret the acid test if considering depriving a person of their liberty. The acid test was set out in the Cheshire West ruling in March 2014, and the ruling stated that a person who lacks relevant mental capacity to make decisions about their care or treatment arrangements are deprived of their liberty if the following two conditions are met. The first being they're not free to leave the accommodation, and secondly they're under continuous supervision and control. So the question is, if they could leave, would you stop them? And the answer is whether they demonstrate signs of wanting to leave or not, a DOLS is required. This sort of is to clarify that prior to Cheshire West, we would only apply for a DOLS if somebody was banging on the doors and wanting to leave. Following Cheshire West in 2014, we have to apply for a deprivation of liberty if a person is not free to leave and is under continuous supervision and control. So if there are any concerns that a patient lacks capacity to consent to hospital stay and treatment, mental capacity assessment MCA 1 must be completed, and if required, the best interest decision on consulting with other relevant persons must also be evidenced, and we do that via completion of MCA 2. The following slides are just to raise awareness of restraint. The Trust Use of Restraint Policy 2019 defines restraint as an intervention that prevents a person from behaving in ways that threaten to cause harm to themselves, others, or trust property and or equipment. Restraint is something that restrains, ties, fastens or secures. Restriction, on the other hand, is the active restriction within boundaries, such as boundaries of an environment. Following on from the previous slide, this slide provides some practical examples of restriction and restraint. So if we start with chemical restraint, that's the use of any medication to calm or sedate a person. Environmental restraint is using locks or keypads to stop a patient leaving a secure area of the ward or department, and removing items from a person which may cause them harm. Physical restraint can include bed rails, cot sides, wheel straps, mitts and splints. Physically laying hands on a person so that they can be given care or treatment, or physically stopping a person from doing something which could cause them harm, considering the least restrictive option available. This slide looks at restraint under the Mental Capacity Act 2005 Code of Practice. In section 5, that really depicts that in a situation where restraint is being considered for a patient who lacks capacity, the MCA does allow for treatment to be provided as long as it's in the best interests of the individual. Even if that person objects to the proposed treatment or admission to hospital, the action might still be allowed under section 5. Section 6 of the Code of Practice describes how there are limits as to whether force or restraint can be used to impose treatment. For example, who has the specific authority to act or make a decision in a specific instance. This slide is to raise awareness of the 3 conditions that need to be satisfied within the Mental Capacity Act to allow restriction and restraint to be used in the patient's best interest when they lack capacity to make decisions for themselves. The first being the patient lacks capacity in relation to the matter in question. Again, this is where we would utilise our MCA1 forms to have a decision-specific assessment. 2, the clinician reasonably believes that it is necessary to do the act in order to prevent harm to the patient or others. So that's looking at its balancing your risk. And thirdly, the act is a proportionate response to A, the likelihood of the patient suffering harm, and B, the seriousness of the harm. So in essence, it's looking at the less restrictive, most proportionate response to prevent likelihood and seriousness of harm occurring to the patient. This slide is to raise awareness of the importance of good record keeping. In the first instance, a mental capacity assessment, MCA1, must be carried out and documented, and if it's deemed that the person lacks capacity, then the MCA2 best interest decision form also requires completion. That should be done in consultation with relevant others, for example family and other colleagues. An IMCA might be required if there are no family members available. I think it's also really important that staff familiarise themselves with the Trust Policy and Procedural Guidance, in particular the Mental Capacity Act 2005 and Deprivation of Liberty Procedural Guidance, and the Use of Restraint to Patients, Adults and Adult-Sized Children and Young People Policy, and both of those documents can be found on the intranet. And finally, before we move over to the children's update, this slide is just giving you an awareness of the Deprivation of Liberty Safeguard application figures throughout October, November and December. The Trust MCA Dolls team continue to review and monitor during the 7-day urgent authorisation, and if a patient isn't discharged or if they haven't regained capacity, then the forms are processed to the local authority for standard authorisation. And you can see in October there was 88 applications at Sunderland Royal and 40 at South Tyneside, making a combined total of 128. In November there was 113 at Sunderland Royal, 51 at South Tyneside, making a combined total of 164. And in December there was 89 at Sunderland Royal and 43 applications at South Tyneside, making a combined total of 132. And before I hand over to children, I just want again to reiterate, if anybody needs any MCA or DOLS advice or support, then please contact us on our single point of contact number, and we will do all we can to provide you with that support. Thank you.
Hello, it's Kerry Pate here, name nurse Safeguarding Children. Over the next few slides, I'm just going to give you a short update from a Safeguarding Children perspective. So during this time of uncertainty during the COVID-19 pandemic, it is particularly important to safeguard children who may be at increased risk of abuse, harm and exploitation from a range of sources. However, it is equally important to safeguard the families, with parents facing significant pressures to continue to protect and promote the welfare of their children. These parents may already be struggling, and so with additional pressure, the likelihood of harm or significant harm may increase. With this in mind, we always encourage you to think family during your consultations. Referrals to children's social care at this present time have remained consistent. Approximately 110 referrals per month are made by STS-FT staff to safeguard children. Most of the referrals generated are in relation to parental mental health concerns and the impact upon children. And during December we saw an increase. This equated to 49% of the referrals made. From experience, we know that children who are abused and harmed are often unseen and unheard. Due to the current national lockdown and social distancing measures, the ability of children and families to access the usual range of traditional face-to-face networks of support is limited, and therefore the concern is that children are unseen and unheard. So I urge you, please make every contact with children and young people count. Think holistically and assess risk with the tools you have available to you, including Quilted, Heads and MSET. Be professionally curious, think the unthinkable, and finally listen. The voice of the child is paramount within safeguarding. Over the next two slides, I'm going to give you an update on the two partnerships we predominantly work alongside, which is Sunderland Safeguarding Children Partnership and South Tyneside Safeguarding Children and Adult Partnership. There's been lots of changes within SSCP. There is a new team within the business unit. There is Marianne Hussein as the independent scrutineer, Nicola Appleby is the business manager, and Pamela Finn is the Practitioner Forum coordinator and training lead. Currently face-to-face training has been suspended due to national guidance. In the meantime, some sessions are being offered via Microsoft Teams, and you can find the updates on the website. The Practitioner Forum is a new learning model. The forum will provide an opportunity for frontline practitioners to have open and honest discussions about the effectiveness of the work we do in Sunderland and the services we offer to young people and their families. This will allow us to identify gaps and areas of improvement for future planning. The first priority is going to be on complex adolescents. If this is an area that you are interested in and work within, then please contact me for further information. Over the next two slides, I'm just going to give you a summary of some of the maternity priorities. Firstly, ICON. This is a research-based initiative which will be promoted across South Tyneside and Sunderland to help prevent abusive head trauma. The key message from ICON is infant crying is normal, comfort methods can help, it's okay to walk away, and never ever shake a baby. This is an evidence-based programme consisting of a series of brief touch points and interventions that reinforce the simple message. We've also included a link there for further information so you can do additional reading, and a video which can be used when working with families. Further training will be offered, and the details of this will be on the Safeguarding intranet page in the near future. Safer Sleep Week is between the 15th and the 21st of March. South Tyneside Safeguarding Partnership will be offering briefing sessions for multi-agency partners in order to spread key messages, resources and learning to professionals in order to support families. Safer sleep advice saves babies' lives. The sessions will be delivered on Monday the 15th of March, Wednesday the 17th of March and Friday the 19th of March. To book a place on the session, please forward your details to stscap@southtownside.gov.uk.
Hi, it's Vicky from the Looked After Health team. Quick update from last time. The current number of children in care in Sunderland remains consistent at around the 630 figure and South Tyneside around the 300. What we did see before Christmas was a sharp increase in children and young people requiring care. We as a team saw all of those children within timescale, and thankfully the numbers have stabilised in January back to average entry limits. Unfortunately, the national lockdown has resulted in our health assessments again being completed by telephone. The team are triaging each health assessment, and should a child or young person have identified health needs, they will be seen either in a clinic capacity or within the community. As a Looked After Health team, we've now begun a programme of joining the safeguarding nurses in supervision across the organisation. These will be with key staff member groups, and the aim is to provide an awareness of the challenges children in care experience, and equally provide an opportunity for staff to meet the team and discuss any cases they are working with. So we look forward to seeing you. If anybody does need any specific supervision one-to-one, that isn't a problem either. Please just give the team a ring. Some of the emerging trends are new in the world of cared for children, and note the term that I use there. As part of a national campaign with the aim to reduce the stigma and barriers children in care experience, the Sunderland and South Tyneside Children in Care have been involved in this campaign, and they're asking professionals and those involved in their life not to use the traditional words and terms for looked after children. The children are now asking if we could use the term cared for and not use the term child in care or looked after. When young people are exiting care, we don't call them care leavers anymore, we call them care experience. When children, young people are spending time with their family, we don't use the term contact, we now say family time. And placement is not preferred by our kids. What they want us to say is wherever they live, whether it's in foster care or whether it's in a residential environment, that is their home. So please could we refer to that environment as their home. Nationally, NHS England has released the intercollegiate document, which is our Bible, which tells us what we should and shouldn't do and how we train all of our staff across England. It's a statutory document, and they are still referring to the term as looked after children. Due to this, as a team, we will keep the term, which is in contradiction to what the children are asking, the term looked after health. I do think that does stop some confusion, but what I am asking for staff to do is try to use the terms in their interactions with kids cared for, care experience, family time and home. There is some more phrases, terms that children and young people are pulling together. Together for Children particularly are going to do an official launch on this, but the points that are on that PowerPoint there are the ones that are agreed. So we are running with it, and my request is that we can try and use that as we talk about our children in our interactions. Thanks all. See you next time. Vicky.
Hi, my name is Julie Wanless and I recently came into post as a domestic abuse health advocate within the safeguarding team. I am here to provide advice and guidance to staff so they feel confident in what to do to support someone experiencing domestic abuse. I can be contacted during office hours via the numbers on the screen or by email. Please don't hesitate to get in touch if I can be of assistance, and I look forward to hearing from you soon. Information, guidelines and paperwork are ever changing. Therefore, the Domestic Abuse Intranet page is currently under review with information to be updated in the next few weeks. Flowcharts have been developed which will hopefully simplify the process of supporting a victim of domestic abuse. The Domestic Abuse Bill has been a long time coming, laying out plans to transform the response to domestic abuse. For further information, click on the link below.
Hi, I would just like to take you to the next slide, which is training compliance. As we all know, training continues to be delivered via e-learning, and the compliance remains within our target of 90% across all of our safeguarding training other than our level 3 safeguarding adults. Since its introduction, we are currently sitting at 84%, which is fab news, and I would like to take this opportunity to thank everybody who has completed this programme and also those who have kept up to date with their mandatory safeguarding training. And on another note, face-to-face training or any alternatives that we will offer going forward will be done so once further guidance has been received from the Trust and obviously in keeping with the national roadmap. Once we do decide on what we will be doing and offering to all our staff, we will communicate this via our communications team, the intranet, and also through newsletters and videos such as these, so that you as our champion can cascade this information to your team staff.
I'd just like to end with the main key message, which is safeguarding is everyone's responsibility, but don't feel like you're out there on your own. The Trust Safeguarding team's there to support you in raising your concern, and we can also provide you with advice and supervision. This slide provides our team contact numbers for both adults and children's safeguarding teams and maternity team. So we've got our single point of contact for South Tyneside, it's 202 4135, and we're based next to pathology. It's Sunderland, it's 5410 and we're based in M1 next to cancer services. And our looked after team are based at Durham Road Children's Centre on 569984, and we work Monday to Friday 08:30 to 1700 hours. So please get in touch if you've got anything that you need advice and support with, and we'll be more than happy to help.